Our bodies need glucose for every single thing. But fructose, I've heard, and correct me if I'm wrong, that it is only stored as fat cells. It's not stored in the liver or the muscles.
So you have high blood sugar because you're not absorbing it in the cells, or you've overwhelmed your body with too much sugar, or your pancreas cannot pump out enough insulin to manage what you're putting in your body. So, or your pancreas is just tired, right?
We think agave is a better choice, but it's only lower on the glucose or the glycemic index because the fructose is way up there.
He's saying, I'm dehydrated. My cells are screaming for fluid, but they're being pulled into the bloodstream because they're so high of solutes, right? And then your kidney is streaming them out. So which is where you get kidney damage, pancreatic damage, liver damage, because everybody's working to get rid of this excess sugar while the cells continue to starve.
Hi, Jamie. Thanks so much for being here.
Thank you. I'm glad to be here.
Oh, good. I know it's been a busy morning so far, so I appreciate your time, energy, and the valuable information that you're going to bring in this episode today.
Well, thank you.
So today we are discussing blood sugar, but really with your background and talking about diabetes, specifically type 2 diabetes, warning signs, prevention, statistics, all this kind of stuff. But prior to jumping on and recording, you mentioned you just dove into a book about, I think it was about diabetes. I'd love to hear a little bit more, and if you could share that with the listeners.
Well, I love WebMD. There's a professional site, and then there's what we call the layperson site, just a site for everybody else. And I kind of prescribe to both of those. And so when I saw this book, Take Control of Your Diabetes Risk by Dr. White, I jumped on it because, and I ordered it off Amazon, but he's the chief medical officer of WebMD. They've got lots of resources for practitioners and for just people who are interested in understanding more medical knowledge, about themselves and about maybe things that their doctor might have said. So I'll just preface that by saying when a patient comes to a physician's office or a practitioner's office, whether it be a nurse practitioner, PA or whatever, it's so helpful when they come prepared. So the more you know about your own self, the more you know about maybe things that you're challenged with, health on a health-wise basis. And you can be very specific, even writing down those questions, making sure you have whatever supplements you're taking, whatever medications you're taking, and being a very active part in your healthcare is very helpful to the practitioner. So, and it also is helpful in letting them become a partner with you. They want to be your partner. But when you walk in just completely unprepared and you say something like, well, I haven't been feeling really good, and you're very vague with your symptoms, they have limited time. They can't sit and dig all that out of you. So the more prepared you are, the better. The second thing I would recommend is that you bring a partner with you to your appointments. It's always good because what you don't hear, they may hear. And then bring prepared to make notes. Because after you take those notes and you get through with your appointment, then you can go home, review them again. You may have some more questions and you can always call back up to the office. You may not talk to the practitioner, but their nurses are highly educated and can usually help you or find out the answer to your question. So I'm just kind of starting out with that because.
No, those are phenomenal pieces of advice. And somebody so I've been in the hospital since I was 3 years old, going through a variety of things. And I think you mentioned 3 things, but you mentioned a few things that are so important because especially when you're going into appointments, you don't know what kind of information is coming out with you. And it's easy. So I have a lymphatic tumor. They found out I had that from an early age. My mom went into the doctors and they just hit her with this. And, she thought it was a regular appointment. And all of a sudden she turns around and 10, 15 doctors are rushing into the room. Well, you're kind of blacking out at that point because you're so overwhelmed. You're not able to pick up on everything. Mm-hmm. So having that second person, whether it's just a normal appointment or not, and luckily we live in a day and age now, FaceTime. So when I was pregnant and, somebody couldn't come with me, I FaceTimed either my husband or my mom so that they can listen in the background. So if there's something that I'm just feeling too overwhelmed, they can pick up on the information. So I absolutely love that you put that out there. And, whether you're going to a naturopath or a Western doctor, particularly Western, they don't have that much time. I mean, you could be in there for 10 minutes. It's very quick. So the more information that you have prepared, the more you're getting more for your money. Because if they have to start dissecting and asking all these questions, you're going to have to do a follow-up appointment just to, touch the surface level of it. So that is fantastic pieces of advice. I appreciate that. Now, Jamie, before we dive into the conversation today, I'd love to explore with the listeners how you got in this field, because I know you've gone through a variety of positions through your nursing career, through transportation management, and eventually holistic health. But how did you even get into this field?
I just love learning. I love growing. And when it comes to the body and health, it's pertinent to everyone. So I guess another love of mine is service to people. So a lot of people are frustrated. I was frustrated before becoming a nurse. It kind of sent me into that field, taking care of the elders in my family and felt like I was talked down to or not understanding. This was before the internet, of course. So we had more limited resources, but I thought, I don't like being ignorant about my own body. I don't like being ignorant about understanding what they're talking about when it comes to my family and feeling like I have to blindly trust whatever somebody says. I want to be a true partner. So that sent me in. You don't have to be a nurse or a doctor or a practitioner to be a partner in your healthcare. But for me, that was a path, a journey that I took. But there's this quote by that a friend of mine just sent to me. It's by Florence Nightingale, and I've always loved it. And it says, let us never consider ourselves finished nurses. And I would say finished people, right? Individuals, because we must be learning all of our lives. And I think it's part of the joy of living is to continuing to grow, gain knowledge, gain skill, and then using that to serve other people. So, that's what drove me into the field, and that's what keeps me there.
You give me goosebumps, Jamie. I think every time I talk to you, whether it's virtually or in person, I admire you so greatly. I mean, listeners are only going to get bits and pieces, but your drive for learning, for service, you exude this, I don't even know how to put it into words, but I feel like you are going to thrive, longevity and just giving back to the population with true authenticity and genuine nature to help others. But you show it. I mean, you're climbing mountains and you're eating health food and, nothing is stopping you in your desire to constantly learn. And now, how much longer do you have in school right now?
I'm just in internships right now. So just following and practicing and working with patients before I take my boards. But yes, it's been quite an adventure. But
yeah. So age is just a number when it comes to you, because you are taking advantage of life and using the time that you have on this earth to absorb all the knowledge and help as many people. So I absolutely love it. And I admire your work ethic and just your desire to learn and grow. Now, I know you have this desire to help, but what keeps you motivated and driven even with that heavy workload? I mean, right before this, you were at clinics and it's just constantly go, go, go. And you have a full family too. So what keeps you motivated?
Well, I think it's just what we said. I like to preface that again by saying that I am not unusual. I meet people every day who are aging so well and full of life and looking at this next stage of the journey as just another adventure. And I love it. I surround myself with people who are positive that way and all growing. And, most of my friends love to hike and be outdoors, and, we enjoy good books, good company. So I'm not unusual. This is a new age of longevity. There's so much research when you talk about that out there. As far as research goes, and what drives me to research in particular is because that's where we find our answers. That's where we differentiate between what people have done forever and what really is working. Because what works for one person, and even that is only suggestive, right? I really like to preface that as well. Research is suggestive for large populations or for larger populations. This seems to be working. But for an individual, you cannot fold an individual into mass numbers of research. You can only get ideas of what works for large groups and then try it on the individual. Or the individual can then try it for themselves. But we all have this unique genetic makeup, and that is part of who we are. And the way I respond to medication is going to be different than the way you respond to medication, Niki. Which, when we talk about diabetes, I love these new continuous glucose monitors, because one of the things that was really frustrating before then is that, people were having to stick their fingers to figure out what their blood sugar was and treat them and trying to figure out, well, what did I eat that sent this off? And you're not going to do that all day long. Whereas a continuous glucose monitor, you can literally see how what you're eating, your lifestyle, when you exercise, you can see exactly what that's doing to your body as an individual. You don't have to take the mass numbers. You can say, this is what, for me, this is what works. And that's what it's all about, really. When we talk about being a partner, when we talk about being aware of your own body, that's your best partner right there, is learning what works best for your body. And so it's a journey. It's a lifetime journey. Yeah, which I
absolutely.
know that.
Doctors can do so much, but we have to take ownership of what we're able to do. And I mean, I know that there's like a quote, a biblical thing. And I feel like it somewhat connects. Without him, we can't. Without us, he won't. And I feel like that translates a little bit to the medical field too. Like, we have our part that we have to, a pill's not going to solve everything. We do have to take ownership and, become aware and, ask and fight and do all these things. So I would love to continue the conversation with CGMs, which we'll dive into a little bit more. And I think you would actually be a good resource too of, what are some good companies to reach out for? How can we access these? But first off, I'd love to dive into the prevalence of diabetes in the US and really just lay the foundation of how bad this disease is.
Okay. So one of the things I loved about the format of this book is that before each chapter, he has a set of questions. And they're just true and false statements. So you say true, false, true, false. So when it comes to statistics, I thought it was kind of fun to say just 5 little true falses. Okay. So the first one is diabetes is the second leading cause of death in the United States. So answer that in your head. True, false. Prediabetes affects more than 100 million Americans. True, false. Type 2 diabetes is partly genetic. Type 2 diabetes is uncommon in people younger than 25 years of age, and obesity is a major cause of prediabetes. So, in your head, I'm sure you've answered true, false to those. Let's see how accurate you were. The first statement is diabetes is the second. It's not. It's the 7th leading cause. However, I always like to preface that with diabetes. I have this wonderful diagram that I love to refer to when it comes to what diabetes does to the body. And you can see, I'm not going to go over all of that with you, but look, every part of the body is impacted by diabetes. So we may not have diabetes on the death certificate, but you have an MI and you had diabetes. It was a huge driver. You had hypertension that caused a stroke. Huge driver of that stroke was your diabetes. So I am suggesting that you had endocrine disease, anti-inflammatory or autoimmune disease. A lot of those are, the risk is much higher if you have diabetes. So it might be the 7th ranked cause of death on a death certificate, but it doesn't mean it wasn't a huge driver to disease.
I think I've read, and correct me if I'm wrong, but heart disease is number 1. And if you have prediabetes or diabetes, I've heard that it doubles your chance of getting heart disease if you have
More
prediabetes
than
or
doubles.
diabetes.
Yes, it more than doubles. Yes, it's true. So, diabetes, the way that affects the blood, the vascular system, is it damages your vascular and arterial lining. So when you talk about arteriosclerosis, the reason your risk goes up is because your lining of your arteries and veins are damaged. And so there's more risk for those fat globules to stick within those and cause arteriosclerosis or fat buildup. And then that plaque breaks off and goes to your brain and causes a stroke, or goes to your heart and causes a heart attack. You see, goes to your lung and causes a pulmonary embolism. Do you see how the impact of diabetes can really affect that? So, and there's other pathological reasons, but that's the easiest one to think of. And then the second one is prediabetes affects more than 100 million. It's 80 million, so we're splitting hairs, but we're expecting this came out in 2022, I believe these statistics did, and we're expecting in 2025 that it will be over 100 million. It's just epidemic. It's growing every day. Does diabetes, is it genetic? What we know is that less than 15% of the reason somebody is diagnosed with diabetes has a genetic component. So it's a driver. And are you referring
specifically type 2, or are you saying type 1?
Type 2 is what I'm talking about. So type 2,
okay, because we know type
has
1
a genetic component for sure.
Yes,
but type 2, and that's what we're focusing on today, only about 15% of that driver in your body, in your individual body, is going to be driven by your genetics. And a good example would be that my grandparents, all 4 were diabetics. My parents were both diabetics. There's 3 girls, 2 of them are diabetics. I'm the only one who isn't. So,
and you're on no medication.
I'm on no medication, but it's I'm at high risk. So knowing that about myself, and this is another thing that you should take to your practitioner, is your family history. Because knowing your family history helps you, it gives you knowledge and helps you understand, I may not have as much leeway. I might be a little bit closer to that cliff drop off, right, for disease than somebody else. And I need to be aware of that and take action, preventative action, because prevention is everything. That's another driver to my practice, is that I really believe in prevention. If you wait till you hit a disease state, it's so much more difficult. Whereas prediabetes, if you have that diagnosis, that is a diagnosis that can be reversed. It is a preventative diagnosis. They've just started even making a diagnosis over the last 10 years. So prediabetes is a diagnosis that can be treated and easily reversed within a year, right? So it's just gives you hope. And then it's uncommon for people younger than 25 years old. So people older than 45 are most commonly diagnosed, but it's more frequently becoming more and more frequent in young people. So I substitute or come in and assist school nurses in doing screening about twice a year. One of the things we screen on in health screening is nigricans, nigricans. I don't know if you know what that is, but it's a discoloring of the neck for children who have diabetes or prediabetes. Okay. So we'll go in and we'll look at their neck and we'll look for discoloring at the neck and the arm folds. And it's very common. It's very, very common. We note their health records. We send information home to their families. We talk to them about what might be driving this in their health and try and just do a lot of prevention in the community. But I do this for kids in elementary school, middle school, and high school. And it is more common than I expected it would be. And then obesity is a major cause of prediabetes. It is true that obesity is the main driver for prediabetes. So, and we're all fighting that, aren't we? So, I mean, nobody's perfect with obesity, and obesity is only one risk factor I like to keep saying that obesity is one risk factor There's multiple risk factors. So you don't have to say, okay, I can't lose weight, therefore why bother? Right? Mm-hmm. Because it's just one risk factor. And there are plenty of people who are overweight that don't have diabetes. So, that's not necessarily a death knell that you're overweight.
But I would say there's chances that there's some sort of heart issues or some other conditions. If you're significantly overweight and don't have diabetes, there is a chance. I mean, obviously it's putting more inflammation and pressure on your body. So
it's significant is the word. And also you need to combine that with genetics and age and activity level. So there's so many more things. I think in our culture, we get hung up on people who are overweight and we don't think about the full health picture because there's lots of thin people who are very unhealthy as well. So I'm not a proponent of obesity or people who are overweight even, but I am saying that you can't just get hung up on that. And that is not the end goal, right? To be thin is not the end goal. The end goal is to be healthy, right? And for some people, being healthy means you're a little bit bigger than somebody else. You're not naturally going to be, twiggy. I'm telling my age, super thin. You might be, but you might just be an average person, but health and well-being is the most important thing. So Sorry to get hung up on that because in our culture is so negative to women. And I just hate that we all feel like we have to look like Barbie and we don't.
I know. And it's such a small population that is really that teeny tiny body. And I think that's also what we see on social media. That's what's posted. But I think when you look at the majority of the population is overweight. So we're on this scale. It's just what we're seeing in the news, what's trending, what's doing well is this tiny figure. Now, in regards to diabetes, what are some of these warning signs that we can look out for or maybe ask ourselves, hey, am I struggling with this?
Well, I wrote it down so I wouldn't forget something, but basically it's when you're just thirsty all the time and you can't get enough. You just feel thirsty all the time. You can't get through sleeping at night. We have to get up several times to get a drink of water. Okay. So that's a good indicator. Another one is the same thing, urination. You can't go to bed at night and wake up the next morning. You have to get up several times during the night and go to the bathroom. You can't get through a movie at the movie theater without going to the bathroom. The other one is hunger. You're just hungry all the time, but, and you get adequate dietary intake, but you're still just starving. And, extreme fatigue. You're exhausted. You just can't get off the couch. You've got things to do, but you're like, blah. So, and you've got plenty of sleep. You just don't have any motivation. Vision is a huge one because vision is, retinopathy is destruction of the retinal in the eye. And it's caused by diabetes. And a lot of people find out they're diabetic when they start getting blurry vision and they go in and find out that they're starting to have retinal disease. And then they'll be referred to the physician and find out they have diabetes causing it as a driver. So it's one of the early things that are just because the eyes are so highly oxygenated. So it's one of the first things destroyed, one of the first organs that it destroys. You get cuts and they just don't heal. You just don't heal very fast. Weight loss, people get surprised with that one, but weight loss, but you have consistent calorie in the beginning, you just start dropping off weight. That tends to be type 1 though. So if you start to drop weight, you want to go in and have your blood sugar checked. You want to go to the doctor and check with that. And then neuropathy is a big one that happens too with people. Their feet hurt. Like that kind of needles and pins. They can't feel like they used to. I mean, we'll do these filament tests on the feet and people don't have the same kind of feeling. That's from the destruction that diabetes is doing to your body. So those are some of the first signs that people go and get diagnosed, but hopefully those are late signs. You don't want to get there before you get diagnosed.
That's great. And I can't remember if it was you I was talking about, but I was having a conversation with somebody, and it very well could have been you, how do we determine if somebody's having an issue with incontinence or is it prostate issues? And for some reason, I want to say it was you that if a man is getting up in the middle of the night to use the restroom, I would think, okay, it could be prostate or it could be incontinence, but it also could be an indicator of diabetes. And Jamie, do you recall if I was talking to you about this recently?
I have talked to people about this, and I may have talked to you about it, but it's with women, hormone issues will cause that as well as they start going into premenopausal, or what we call perimenopausal, premenopausal, and post.
Okay.
We call it perimenopausal. It's that period around that in your 50s that will cause that as well. But you need to get it checked out because it is also an indicator of blood sugar dysregulation. So,
well, what I'm curious, and I think I actually now remember who I was talking about. Do you understand, or do you know the science as to why we are increasing urination? If there is what the connection behind blood sugar and urination is?
Yeah, it's because what's happening in type 2 diabetes, especially, is that your cells, so sugar and insulin work together to feed the cell energy, right? Your cells need energy. So one of the big drivers for type 2 diabetes is that you become insulin resistant. So there's plenty of insulin. The pancreas is pumping it out. In fact, it's pumping it out too fast because you've got blood sugar, high blood sugar levels. And so insulin's pushing out all this, or the pancreas is pushing out all the insulin so that the cells could then absorb it for energy. But what happens is the cells become really resistant to it. It's been overwhelmed, and the pancreas becomes overwhelmed and begins to wear out. So between all of those factors working together, it's never just one thing. It's always multifactorial. But you've got a lot of blood sugar floating through your body. So if you think of osmosis, right? Where is the fluid going to flow? It's going to flow to highest solutes, right? So if you think your bloodstream is going to be high in solutes, it's going to pull the water. That's why you're thirsty. You can't get enough fluid. So your body's saying, I'm dehydrated. My cells are screaming for fluid, but they're being pulled into the bloodstream because they're so high of solutes, right? And then your kidney is streaming them out. So which is where you get kidney damage, pancreatic damage, liver damage, because everybody's working to get rid of this excess sugar while the cells continue to starve. So the cells are telling your body, we need energy. But they can't get it. Then the pancreas is saying, I'm doing my part. I'm pumping out all this insulin. But then the cells get overwhelmed. They can no longer deal with all the insulin that's being thrown at them because they become resistant. Meanwhile, this high sugar level is pumping through your blood sugar, which is why we check the blood, right? We want to see what level of sugar is flowing through there. It's not going into the cells. It's staying in the blood, right? And then we've got to get rid of it, so it's going out through the kidney. So our body is just this amazing organ. I mean, this amazing system with all these different organs working together to try and keep you balanced. So what's ever in your bloodstream really is a driver to how all your organs are functioning and your body, your thirst mechanism, your urination and all that are working together to try and keep your blood sugar, your blood levels, your chemistry in your blood at a certain level, right? Because it's not good for you. It's not good for your body, and it's destructive to your organs. So
absolutely.
I don't know if I answered that well.
No, that absolutely did. And it's fascinating how our bodies work. I mean, you think about pain and inflammation, how, if I have a headache, I'm really going to try to let my body heal itself before. And, I'm a proponent of integrative medicine. I've had to use Western for a lot of things, but that's going to be my last choice. I'm going to try to do things naturally, let my body take over, because it's trying to get rid of, like a fever. It's trying to get rid of what's going on or try to reduce it naturally. So it makes sense. And our bodies are just fascinating systems. Now, we obviously are going to spend, the time today talking about type 2, but just really quickly, and we have touched upon it. What are those main indicators or the differences between type 1 diabetes and type 2 diabetes?
Well, we actually have 3 types of diabetes. We have type 1, type 1.5, and type 2. So type 1 and type 2 are autoimmune. They're autoimmune diseases. Type 1, there's an identifier. It's a
real quick. Type 1 and type 2, or type 1 and type 1.5?
Type 1 and type 1.5.
Okay.
Okay. They are, they're caused, it's an autoantibody. That's what we call it. An autoantibody that is attacking the body. Okay. It's attacking the pancreas specifically and destroying the pancreas. The difference between 1 and 1.5 is that 1 is much faster, the type 1. And there's all kinds of research right now and new tools in our toolbox that can help slow down the progress of type 1. So the earlier it's discovered, especially in children, because that's where usually type 1 people under age 35 are have, that just get into a good doctor, get referred to an endocrinologist if you're a type 1, and get access to these great tools and medications and programs that can help you keep it from progressing to full-blown type 1. But type 1.5 is the same thing, except that it goes at a much slower pace. They don't have the same there's different autobodies that they test in the blood to see if you have this. Type 1 has 2 types of those autoantibodies, where type 1.5 only has 1. So you can go much longer and maybe prevent ever going into full-blown type 1 when you're type 1.5. And the only way to know that is to go in and get tested. So your doctor knows what those autoantibodies are. They'll test for them and they'll let you know which one you are. But a lot of people who are 1.5 get diagnosed as type 2. And yeah. So, and they don't respond to treatment, type 2 type diabetes treatment very well. So they're like, I am doing everything. I've lost weight. I'm eating right. I'm exercising. I'm taking my medication like I'm supposed to, and nothing is working to control my blood sugar, or they're actually a type 1.5 diabetes. So
what do they do to get that? So do they just need to find another endocrinologist to do?
No, they just go to an endocrinologist. So a lot of people never even go to an endocrinologist. They just go to their primary care, and they just try to manage it with primary care. But if you're doing everything that you know to do and your primary care has maxed out on how they can help you, and they're like, and you're still way under controlled, then it's time to say, I'm going to go to an endocrinologist. I'm going to get checked out on this. So it's good for people to know that you may have some autoantibody issues and you need to get that checked out and check it out early, right? So don't just keep beating yourself against the same wall if it doesn't work, right? Don't go in and make people let people make you feel bad if you know that you're doing what you're supposed to do. You're doing everything you've been told to do. So I keep hearing stories about people who go in and try and talk to their doctor, and their doctor doesn't believe them. Like,
yeah, I've heard that a lot too.
Sure,
and I think there's a little bit of a spectrum of, is there gaslighting, but like also making sure, am I doing the work and they're just not listening to me? Or am I, because I hear both sides where, we push it off where I am doing the work, but you really look at what they're eating, what they're doing with their body. Have they lost weight? You look at their health, and it's nowhere what they are communicating. So it's kind of a fine line, making sure you are doing the work and putting in the effort. But if you're not getting the answers and doctors aren't listening and you are certain, then, keep pushing for your health. Find another doctor who will listen and take the time.
Yes, because practitioners are overwhelmed and they hear the story that I'm doing everything you told me to do, and people aren't. So you have to be your own advocate. You really do. Mm-hmm. And you might ask, I'd like to get referred to an endocrinologist because I know I'm doing everything, and get some further testing. So, and then, like I said, there's all kinds of advances. So that's where you'll probably
and then real quickly, so we did type 1, type 1.5. What are there any little pieces about type 2? I mean, this is generally, you get this through diet and lifestyle, and this is reversible through diet, lifestyle.
Well, 15 to 20%, it's usually around 15%, is a genetic. There is a genetic component to that. So, you do have to recognize when you're high risk. So right there. But then basically type 2, it's a disease of cellular resistance. It's that same scenario I told you. You've got too high a blood sugar level. Your body isn't, and that's where genetics comes in. Some bodies are more efficient than others at disposing of that blood sugar. And if you have a family history, then you're going to know that your body's not as good as maybe somebody else's. So you're going to have to be extra careful. And then you stress out your pancreas. Your pancreas is exhausted because it's just shooting out all this insulin, but your cells aren't taking the insulin. And then, of course, they're not using the blood sugar. So that whole scenario that I explained to you, that is the scenario of type 2 diabetes. And there's lots of things you can do to decrease risk of that.
Yes. So, and so there are a few key features of type 2 diabetes, which it sounds like you've mentioned a few, that insulin resistance, the insufficient insulin production. And I think there's a third one that we've had a conversation about is hyperglycemia. What do you mean by that?
Hyperglycemia is high blood sugar. That's all it is. It's just a fancy word for saying high blood sugar. So you have high blood sugar because you're not absorbing it in the cells, or you've overwhelmed your body with too much sugar, or your pancreas cannot pump out enough insulin to manage what you're putting in your body. So, or your pancreas is just tired, right? So
now I think we know a lot of the long-term consequences, but I feel like you have a list of why is identifying and treating type 2 diabetes so important? I mean, beyond the most important, reducing risk of cardiovascular disease, but what other things, if we identify and treat, but what other things can we reduce the risk of?
Well, that's why I had this little thing right here. So what I'm going to do is share this with you, and maybe you can share it online. But it is every organ in the body is affected by hyperglycemia, basically. So you're doing major destruction when you have high blood sugar and it reaches up to, high levels continuously. You're destroying your body because your body.
What is a high level? What's the optimal?
Well, you want to stay around 100, right? So you want to stay less than 100 before you've eaten. They call it preprandial levels. You want to stay less than 100. But if you're after you've eaten, of course, it depends on what you've eaten, on how high your blood sugar is. That would be kind of somewhere between 70 and 100. Okay. That's what you want to stay.
Perfect. Okay. So we'll all make sure to find a way to attach that people can maybe even download that visual, but reducing risk of organ damage. I mean, like you said, it affects all the organs.
Right.
I mean, thyroid, digestive.
Mm-hmm. Yeah. And hypothyroidism is huge. So it definitely increases your risk for hypothyroidism, which affects your entire body. There's also the digestive system. It impacts that. So in various ways, which I thought was kind of interesting. I wrote this down. It causes gastroparesis, which that's caused by the vagus nerve damage. And then it can also cause constipation, which you don't think about, but that can also, that's due to nerve damage because it really damages the nerve system. So you can start having those issues, but also diarrhea because of malabsorption. So then you're not able to absorb your nutrients like you're supposed to. So those are things that it can cause. And then it affects the endocrine system. And that's, like we talked about, responsible for insulin and all the hormones in our body. And then the brain. We talk about the brain. It's not good for your brain, mainly because of the vascular system. You're destroying your vascular system, increasing your risk for arteriosclerosis. All of those things are impacted. So the liver, because it's a toxicity, so it's impacting the liver. There's a disease, a new terminology for liver disease called, I don't know if you've heard of this, but non-alcoholic fatty liver disease.
Yes.
If you've heard of that, that's extremely common right now. people don't know they have it because it's not symptomatic until it's really progressed. But non-symptomatic liver disease, alcoholic liver disease is caused by that high blood sugar. That's basically what causes it. So, and destroys your liver. So we talked about nerve damage, but and most people know it in the form of neuropathy, but also your central nervous system, your brain is affected by it. Visual, we know that. We talked about that, and can also contribute to cardiac cataracts and glaucoma. Thank you. And of course, retinopathy. And then high blood pressure. We talked about that, how it affects the veins and arteries. We talked about skin. That's another area that it impacts, is your skin. So people who are diabetic really have trouble with dry and flaky skin. So the cellular overgrowth to maintain good skin is not possible with diabetes. It's difficult. It interferes with that process. So I'm trying to think. Of course, pregnancy, we know about gestational diabetes. So if you've had gestational diabetes during pregnancy, you're at higher risk for developing type 2. So that's another history that you and your physician need to be aware of that will make you higher risk for type 2. So anyway, those are all some of the things that I thought of, but the list is quite extensive.
Yeah, that's a fantastic list. And, you know, if you can manage and control your blood sugar, you can see right here all the other things that can be positively affected and impact and improve your quality of life and longevity. Now, in regards to, you know, treatment goals for type 2 diabetes, I mean, we obviously know managing blood glucose levels, but what are some of the other, you know, treatment goals that we want to pay attention to?
You need to look at the risk factors for diabetes and then try to eliminate those risk factors. So you can't eliminate who you are genetically. So that's one risk factor that you carry that you can't change. But being aware that overloading your body with sugar and that maybe you're not genetically predisposed to manage that well means that you need to be really careful about your diet and your level of sugar. So we only need about 7 teaspoons of sugar, and you can get that in our diet. You can get that through eating an apple, which has lots of fiber that helps you manage that. So every time you have a piece of fruit, which is a natural sugar, and it's in its whole form, such as an apple, then the fiber within that apple and many other aspects, chemical aspects or components of that apple helps your body digest it and use it properly. So you're not going to overwhelm your pancreas. You're not going to have excessively high blood sugar levels from it if you eat an apple a day, right? You take the same amount of fructose and you take it in just as fructose, and it's going to soar your blood sugar. So keeping your sugars in your food is, I think, the number one thing you can do. And not take it in processed foods.
Yeah.
Or putting
dietary
it in
management.
Yeah.
And you know, I read this and I'm curious if you have done some research or know about it. And I have to pull up a little bit more, but I read that fructose, so there's glucose, sucrose, and fructose, and our bodies need glucose for every single thing. But fructose, I've heard, and correct me if I'm wrong, that it is only stored as fat cells. It's not stored in the liver or the muscles.
That's right.
Okay.
It's really not good for you at all. So you need to, at first, when it was first put on the market, we thought it was better for us, but now we know it absolutely isn't, which is one of those things that research has shown us. Enough people researched it. They put the information out. It isn't something we guess about anymore. We know from the data. So,
well, and I heard too, you talk about, you know, some people, and I was vegan for years. I was raw vegan, and, you know, you go for agave, and at the end of the day, agave, honey, cane sugar, coconut sugar, it's all doing the same thing in the body. And the amount of micronutrients you're getting, I read that, a teaspoon of honey and the antioxidants it provides is in or I should flip this, a half a blueberry has the same amount of antioxidants that a tablespoon or a teaspoon of honey does. So that debate of, well, you're getting all these antioxidants, it doesn't compensate for the negative effects. And we're not here to scare you with this stuff, but to be conscious and aware that you're really not getting as much of the benefits or more so of the harm. And agave, it's lower on the glycemic index because the glucose is lower, but that's because the fructose is higher. So we, have this conversation that we think agave is a better choice, but it's only lower on the glucose or the glycemic index because the fructose is way up there.
Yeah. And, this kind of conversation can really overwhelm people. It can just, They can feel like, what did she just say? And I feel like there's this, I've met several people who were in pre-diabetes and they really want to change, and they just get so overwhelmed by the information and these kinds of conversations. So what I recommend to them is don't all of a sudden just become, I can't eat anything. Because Niki, if you go to the store and you pick up a box of anything, it's going to have sugar in it. We're overwhelmed by sugar in everything. It's going to have some form of sugar, like you said, agave, honey. We feel like we need sugar because our taste buds have been basically hijacked to feel like if something tastes good, it must have sugar in it, right? So, I think this brings us to a really important part of the conversation, and that is finding good health partners. So finding a good health coach who understands diabetes, and finding a good nutritionalist who has a functional medicine or integrative medicine background who can help you figure these things out. And there's also some really good resources online. WebMD has some good resources for diabetics. The American Diabetic Association has really good resources. I have created a list for you that you can share with people, so you don't have to have money to find help. And you can start simply, because every change you make, it's just like when they talk about what is optimal for exercise is 150 minutes a week. That's what we tell people who come to the office. We say what we want you to work up to is 150 minutes of exercise a week. And we talk to more about how you break that down between aerobics and weightlifting and those kind of things. But that can be overwhelming to somebody who has neuropathy, right? Who's struggling with just trying to survive, who hasn't exercised for years, or who maybe is overwhelmed with just their family situation. So when you say what we've shown in the science is that if you just add exercise to every day, more activity every day, like making a walk around the block or making sure you get out and walk to the mailbox every day. For some people, that is an increase in activity level, believe it or not. So you need to start where you're at and figure out how you can add a little bit more every day to optimize your health. And it's good to have partners to do that with, because it can get overwhelming and it can get discouraging. The other thing that I like to tell people to do is journal it. Journal your progress. So I started this with rehab patients, people who are in physical therapy post heart attack or stroke. And they would get so discouraged about 60 days in. They're like, this is it. This is as good as I'm ever going to feel, which isn't true at all, but it feels that way. 60 days into something feels like a lifetime sometimes. So we would start out with a calendar where they would mark how far they just once a week and then once a month. So for the first 8 weeks, we do once a week. And we would say, where were you a week ago? Well, you're 10 steps further than you were a week ago. You're lifting 10 pound weights instead of 5 pound weights. Whatever it is, document it so you can look back and feel more encouraged. And then have partners, and they don't always have to be health partners. They might be a daughter. They might be a son. They might be a spouse. They might be a friend or a sister. But having somebody that you can talk through things with and say, who's your cheerleader? Because everybody needs a cheerleader, right? And who can kind of go on the journey with you is really important. As far as the things that help, we've talked about them basically in our conversation already. We've talked about how important activity is to get your muscles working. Muscles are really important. And flushing, staying hydrated, watching your diet. Maybe that might be in the beginning. It might just be say to yourself, I am not going to put sugar in my tea anymore. That might just be one change. Or I'm going to do intermediate fasting because that's what works for me. Intermittent fasting, can't say that tonight. But, so is that going to work for me? Or maybe it's not going to work for me, but there's just certain things you can just slowly try. And that's why I liked this book. I keep going back to it, but also the ADA and WebMD. Yeah. Because things like this, resources like this can kind of talk you through and give you ideas. And every time I read a book, if I get one or two good takeaways that change my lifestyle for the better, then I'm feeling like I've made a win by reading that book or listening to that podcast or listening to the TED Talk or whatever it is. I mean, constantly trying to learn and grow and increase your knowledge and stay motivated.
So I'm writing a note because I think I want us to do another episode diving into your favorite books and why. I think you would be such a good resource to pull that apart because I know you just have such a deep heart for learning and just constantly seeking out more information to help others and yourself live best. Now, you just touched on so many valuable points. And one, it was such a good reminder for me because I think I can overcomplicate things. I feel like sometimes I'm an anomaly and I just do, like I can eat salad for breakfast. That doesn't mean, and I do push-ups, before I take a shower. I do crazy things and it's not like everybody has that mindset and it's easy to do that. We have to start where they're at. And, one thing you mentioned is maybe instead of focusing on what we need to remove, what can we add? And that could be a walk around the block, starting to add in those positive factors. Well, like subconsciously change the way we believe or like, I don't really want that today. Maybe if it was sugar in the tea, you start feeling better and it starts building this momentum. So you made some really good points. And before we even dive into, because I'd love to leave the listeners with different supplements they can take to help support their body, addressing all these different organ functions. But I just wanted to quickly go over a handful of these prevention factors that we've discussed. So you mentioned, a balanced diet, regular physical activity, healthy weight. I think one of the biggest things that has transformed my health. So right now I weigh less than I did pre-pregnancy. So my daughter's almost 10 months. And I would say I'm the leanest, fittest, strongest I've ever been, probably since high school. And to be fair, high school, I had eating disorders. So I wouldn't even think that's a fair comparison. The best I've ever been. And I think one of the biggest things beyond balancing blood sugar is limiting sedentary behavior, just moving more, just standing up more, walking more. It doesn't even have to be an actual workout. Just moving my body more instead of, when you get home with your groceries, you try to grab everything in like one load, to do it in multiple loads so that you're constantly increasing your steps. I would say on average, my steps, and I'm sitting down right now, but I have a desk or a treadmill underneath my stand-up desk. And so I'll just slowly walk on that when I'm researching or just, designing different things. I, can average between 20,000 steps a day. And that's through little things. It's not like I'm going out for a 10-mile walk or run. It's just moving my body more, sitting less. I think that is one of the things that's transformed my health. What are some of these other prevention factors? I'm sure smoking, alcohol. What are some other ones that can help us prevent type 2?
So we talked about alcohol is a high sugar. So being very limiting with your alcohol, making sure that if you do drink, that it is for a special occasion, not a nightly occasion. And then, especially if you're at risk, you have a family history, that would be really important. You talked about regular physical activity. I think movement throughout the day is so important. If you can't dedicate 30, 45 minutes to an hour of exercise. You don't have to. So, there's all kinds of tricks and tips you can do that. You mentioned that, like when you're brushing your teeth, doing squats. I mean, it sounds silly, but combining things with things that you do anyway. You're washing the dishes, do some squats or do some leg bends, or if you have to read an article, do it standing at a standing desk. And then you can do leg lifts while you do that, or, whatever. I have yoga blocks that I do heel lifts with. So there's all kinds of things you can do. When you talk to somebody, a health coach, that's the value of a health coach, is because they can talk to you about your lifestyle and they can make those small, minute changes that in the end make a huge difference. So you don't need to just start out gung ho. You make small, minute changes throughout your life towards health. And there's all kinds of strategies you can do. And some of them you can find online, but you can also talk to a health coach and surround yourself with healthy people who have like goals. That's really important. I know this sounds terrible, but if you're a drug addict, the first thing they tell you to do is not hang out with other drug addicts. If you're a sugar addict, it's probably a good idea to surround yourself with people who are also trying to avoid sugar and trying to develop more healthy lifestyle. So, or at least
great point. That makes,
at least supporting you and not, discouraging you. Right.
That makes sense. And one thing you mentioned too, because I think there's a lot to do with habits, and you kind of mentioned it, is habit stacking. So you take a pre-existing habit and you combine it with something new. So something that I do, and I know it's not for everyone, but if I'm just screwing around and I want to scroll my phone or watch some YouTube videos, and one thing I'm like really into right now is push-ups. I don't know. I just do them anytime, all the time. When my daughter's playing on the floor, I'll do them. But if I'm watching a video, I'll just put it on the floor and I'll do a handful of push-ups while I'm watching it. So I'm combining two different things. I moved my bike into the living room. It's not aesthetic, but it does the job. And so when my husband and I watch TV at the end of the night, something that is normally sedentary, and we get to fill our cup, relax, I'm combining that pleasurable habit with a habit I'm trying to do. So then I bike. Or I've gone back and forth with this new rule. If I want to scroll on Instagram, I'm allowed to do it, or I allow myself to do it if I'm on the bike. Yeah, and usually when I'm on the bike, I actually do heavy resistance and I go slowly. I got actually a desk that goes on top of the bike. So doing these different forms of habit stacking, brushing your teeth and squats, it builds all these like little pieces of movement in throughout the day. It doesn't always have to be a 45-minute workout or a class. It's just finding opportunities throughout the day to move. So
I do the same thing. I do the same thing, Niki, just to interrupt you, because the only reason I say that is the bike itself, a stationary bike, is something that anybody can do. And when I've worked with diabetics, especially ones with neuropathy, it is the one form of exercise that they can do. Not everybody has access to a swimming pool, which is another thing that somebody with neuropathy can manage. But their stationary bikes are not that expensive, and you can find them used for $50. Sometimes
Facebook
people will give them to you to come and pick them up, because people buy them and then they want them out of their house. So, you just need to keep your eyes and ears open. But a stationary bike is an incredible piece of equipment for somebody who is struggling with activity, for the very same reason you said. You can read a book, you can watch a show, and I've done exactly the same thing. It's really a good tool. So, and it doesn't hurt your knees. So that's the other thing. Yes. So people who have knee issues and joint issues, they're not pounding them. So a bike is good.
Well, and what I love to do on the bike is increase the resistance. And by that, I mean, it's harder to push, but you can go slower. So you're not necessarily doing a high intensity and you're sweating. You can do it like sometimes throughout the day. If I need to break up my research, I'll just get on the bike, do a heavy resistance, and I'll do some research on my phone, or, I'll just clear my head. So, and with COVID, everybody was buying Peloton bikes, and now everybody's selling them. So go to Facebook Marketplace. You're going to be able to find stuff like Jamie mentioned. So I know some other things are adequate sleep. You've mentioned and pressed into getting or checking your family history, regular health checkups, you know, and scheduling or screening for and managing conditions are all going to be really helpful ways for prevention.
Yeah.
Now, the bread and butter of all this, the stuff that, you know, keeps our company around is supplementation. And we're not, you know, we're not doctors. We want to, you know, talk to your physician, talk to your healthcare provider, but there are supplements that are supported by research that are helpful for prevention. What would those supplements be?
Well, there's vitamin D, where most Americans, especially if they live in the northern climates, have vitamin D deficiency. So you need to really kind of watch that. It's not an expensive blood test. So when you go in for your annual physical, ask for a vitamin D check. So that's one of them. Having deficiency increases your risk for diabetes. We know that. Okay. Another one is magnesium, and magnesium plays a big role in glucose metabolism. So low magnesium levels are associated with insulin resistance. That's diabetes type 2. Omega-3 fatty acids. So these are the things found in fatty fish, but a lot of people don't like fish or don't have access to fish. So taking a good omega-3 supplement. Probiotics, we are linking the connection to our anti-inflammatory and the gut is huge. So looking at eating rich probiotic foods, rotating your probiotics. It's suggested that you take a new strain of probiotics about every 3 months. You can rotate in and out, but you should try and rotate your strains so you don't end up with something like SIBO, where you've overgrown a certain one type of probiotic, right? Or one
Did I
type
tell you
of
I had
biotic.
SIBO, Jamie?
No, I didn't know that.
I got diagnosed at the same time with SIBO, H. pylori, C. diff, blastocytosis hominis, and candida all at the same time.
That's horrible.
It was miserable.
So sorry.
So if you're listening, do all
Look
the
at
things
her
you
now.
can to
Look at
avoid
Niki now.
that.
Look at Niki now. She's great. You can whip it. You can. Berberine is another one. Potential benefits for managing blood sugar levels. And we have that in our glucose stability as well as vitamin D for that matter. There's curcumin or turmeric that comes from turmeric. It has anti-inflammatory, antioxidant properties. Chromium is shown it's a mineral. It plays a role in insulin sensitivity. So there you go for type 2 again. Alpha lipoic acid, antioxidant. And also, they're showing in some research that it helps with insulin resistance as well. And then cinnamon, which we all love, right? Throw cinnamon on your tea every morning. When I was in Grenada, I was on a project in Grenada. That is a go-to for the people who were born and raised in Grenada, because cinnamon grows on the trees there, the cinnamon bark. And they would use it every single day for generations to control blood sugar. They already knew about it. So the Spice Islands, it's kind of a go-to historically, and now we have data to support it. So I love it when the data supports the historical use. So
absolutely. I bet it's like the most rich, just delicious, potent cinnamon out there.
Yeah. So I would say that, there's so many things that you can do if you are on that path. If you have a family history, start now. Let's say you have no symptoms, no indications that you have prediabetes or diabetes, but you have a family history. That's a 20% to 15% risk right there. So already you need to be vigilant and never get there. If you have prediabetes, remember it's reversible. In as little as a year, you can be back to health. You can get rid of prediabetes, a year or less, right? You may have to go on maybe an oral metformin to help with your insulin sensitivity just for a little while, but you can certainly come off of that. It is not a permanent. If you are diabetic, don't give up, because there are little steps you can begin to take right now. And what we know, when I graduated from nursing school decades ago, we were told that diabetes was not reversible. And we know absolutely that it is. and people are reversing it every day. So if you are diabetes, I cannot emphasize enough how it is time for you to partner. You need to partner with a good practitioner, possibly an endocrinologist. You need to partner with a health coach. You need to find friends who support your journey, your health journey, and encourage you. And then those are where you start. And then the rest is just part of the journey, little baby steps to get to where you want to be. And we're not talking about becoming Barbie. We're talking about becoming your optimum self, right? And being healthy. It's not how you look. It's about how you feel inside, right? So anyway, that's all I can, hopefully that was helpful to you. So.
That's amazing. Now, one thing I do want to touch upon in regards to, you're mentioning diabetes affects all these different organ systems in the body. And luckily, Life Seasons does have products targeting different organ systems. So for instance, one of the categories, healthy organ function, hormonal balance, cardiovascular health. Yeah. I'd love to just, quickly talk about the products that we have that do support that, organ function, hormonal balance, and cardiovascular health.
Well, I made kind of a list. I kind of went through the website and looked at the different things. So I'm flipping these papers around because I want to find that list in front of me so I don't forget something. But remember that if you have diabetes, cardiovascular is heavily affected. So you're going to want to protect your cardiovascular system. And they do have some really good products like and we're talking about natural ingredients that are used to optimize your body's own processes. So your own regulatory capabilities. They're there to support your healthy body processes, not to replace them. So oftentimes in pharmaceutical, we have to step in and force through chemical processes, something that your body cannot do. Whereas in natural ingredients, we're trying to help your body kind of nourish it so it can do what it's already functioned to do, what it's already supposed to do, meet its maximum function, I guess is the right word for it. So the things that I love are like the BP stability product. These are pre-hypertensive, but people who are edging towards metabolic syndrome, right? Maybe they have metabolic syndrome, but they're not on medication yet. This BP stability can kind of bring that down while you try and get back to where your body can manage that itself. Cholest. Again, we talked about how you need to keep that cholesterol in balance, the HDLs and the LDLs, which can be a whole nother podcast, but how you need to keep your lipids in balance. We need them. We need cholesterol, really important part of our body processes, but in our metabolic processes, but we need to have the right type of cholesterol. So Cholest kind of helps balance that. Circularity, same thing. It helps your blood flow, helps your vascular system. I looked at your berberine. You've got a really great berberine there, which we talked about already. Thyroid T. People who have diabetes are really stressing out. Their endocrine system and their hormones are taking a hit. So something like Thyroid T for people who are starting to struggle with that a little bit, or maybe have a family history of it, this would be a really good product to help you protect your thyroid. Of course, just really good multivitamin. Dr. Bredesen created an amazing product with his multivitamin packets. I love them. I take them myself. I've recommended them to people. They are everything you need that we talked about. Vitamin D, CoQ10, alpha lipoic acid. They've got all of those things in there that can just kind of give you a daily boost to your food. And whole food is the ultimate, right? But our food source has been depleted. Our soils are depleted. We're heavily polluted. So it doesn't hurt to have a good, strong multivitamin on board every day, as well as a probiotic to kind of help our system stay in check with all the toxicities that we're being bombarded with, right? So, yeah. So those are the ones that stuck out to me when I went to the website. But again, I can't emphasize how important it is Of course, we want to do glucose stability. We want to talk about that.
Yes.
I think I actually didn't say that one, but glucose stability, how important that is. And what I love about the new continuous glucose monitors is you can see if glucose stability is going to work for you in real time. Isn't that a cool experiment? Just take it
time.
and have your continuous glucose monitor and see when the days that you take glucose stability, the day you don't, how does that impact you as an individual, right? But that brings me back to kind of like what I'd like to finish with is that we're all individual biosystems. I mean, we are totally, every one of us are different, and we can take recommendations from the research, but what we need to do is know our own body, love ourselves, and value ourselves enough to say we're important to us, we're important to the people who love us, and we're going to do everything we can to be our optimal self, whatever that is. So that's how I feel about diabetes and health and all of it. Just go out there and be the best that you can be.
Oh, thank you so much, Jamie, for being here, for the conversation, for the insight, for the inspiration. Again, you're such to be admired, your dedication and your heart. Because I think, sometimes there's the science and the information, and then there's very empathetic people. And I don't know if they always, like, you come across people who have a beautiful combination of it all, and you exemplify that. And so I just so appreciate you taking the time here today to explain this information, to give us, guidance and hope that it's possible, and we're going to meet you where you're at. I need to work on that, but Jamie's fantastic at helping meet you where you're at to help move the needle closer to living this optimal life. And if you take any information away from this, just know that there is hope and there's things available for you. Jamie provided a list of a bunch of different resources. We have some other products in mind too for what blood sugar can affect what other sorts of organ systems and how we can support with that. So I'll be sure to leave that all in the show notes. But any lasting words, Jamie, before we part?
No, I think that I want people to walk away with hope, not discouragement, and go out. And I can't emphasize enough how important it is to find a partner that supports you and loves you in this journey. It makes all the difference in the world. We know that the social is as important as the mental, physical, right? I mean, it is a heavy impact. So look for friends, look for friendship, look for your cheerleader, and you be somebody else's cheerleader along the journey.
Yes.
Don't do it alone.
Yes.
It's impossible to do alone. So, all right.